Okay, so welcome to today's webinar. Today I want to talk to you about one of the most painful condition in a human body. And I want to tell you, the patients who I deal with, especially of this disease, trigeminal facial neuralgia, the kind of suffering that they go through is unbelievable. But what I want to share with you today, that there is a solution. It is a long-term solution, but that solution is homeopathy. So let us discuss today about homeopathic approach in trigeminal neuralgia. First, let's try to understand what trigeminal neuralgia you'll come to know would often be a neurological disorder. So we have certain nerves on the face. There is a trigeminal nerve, it's a facial nerve, and there are three main roots of it. The one is the ophthalmic, the maxillary, and the mandibular. And when there is a stress level, it kind of exorbitates blood vessels, causing demyelination, causing hyperexcitability, and that could cause one-sided facial pain. This, in general, is facial neuralgia. And there can be many things. There, it could also be a kind of shocking pain, electric pain, which often can go to the tooth. You might feel it's a toothache. There might be lacrimation from eye. You might feel there is an eye pain. So it might look at different, but when you get it for a chronic time, think about facial neuralgia. Unfortunately, the treatment for it is carbamazine, tegretol. These two are nerve sleepers, which means they put your nerves and your brain to sleep. The only other treatment is an injection, a radio frequency, and a surgery, a decompression surgery. But what I want to speak to you today about is how homeopathic role is there in this type of disorders. How at a deeper level, homeopathy can help. How at a neurological level, homeopathy can help. How homeopathy is connected to the nerves, to the state of mind, and it can cause a stimulation by which your pains and your troubles can go from the root. And believe me, I have cases. I have some very, very good cases where patients were in deep suffering and we have been put them within a year of treatment, they are off all allopathic medications. And the pain management has been beautiful. This is the power of homeopathy, plain general. So I want to share with you a few of my cases and how homeopathy we try to analyze. So this is a very interesting case of trigeminal neuralgia, 50-year-old man from Hyderabad. So for last 20 years, he's getting this, he used to describe as a left-sided electric-like pain, shock-like pain. And when he gets pain, he can't do anything. He has to just be inside his room, in his bedroom. For days, he has to take painkillers, morphine injections, but the pain doesn't come down. Electric shock-like pains. He has to take tegretol. He has met a very top neurologist from Bombay Hospital without any use. And this is going on for 20 years, and he came to know about me, and he came to Bombay to see me. So the first thing I asked is, how did it start? So he spoke about his son wanting to start his own business, and he obviously wanted his son to join his business. This kind of affected him initially at a younger age. How people don't listen to him. He became very critical towards him. This affected him. He kept a lot of things within himself. But he accepted it, but he kept within. Then I asked him, describe a little bit about your nature and temperament. So he described himself as someone who's very, very health conscious. He's very, very nervous and sensitive about what he should eat, where he should eat. Tea should be hot, not very hot. Milk should be less. He's very, very health freak. Very nervous. Before going anywhere, he'll get nervous. He does yoga, diet, naturopathic therapy. His main feeling when I asked him about his health, he says, I feel my body is very delicate and that I am very, very sensitive about I shouldn't get some disorder. When I asked to describe him more about what he likes, he says he loves helping people. Although he's a little critical, but he loves helping. Like he's very benevolent by nature. His sleep is not good, and when his sleep is not proper, he gets the pain more. He cannot eat outside food, especially oily food. Then he says he gets a dream as if he has done something wrong. He's done some robbery, and someone has caught him, and he feels like a criminal. And he feels a lot of guilt. So when I analyzed this case, his main thing was internally a lot of hidden, suppressed anger with a lot of guilt, with a lot of emotions, with a kind of a feeling as if his body is very delicate. Now this entire idea of feeling as a body is delicate is the idea of thuja, one of the homeopathic remedy. And I confirmed it by checking his warts, especially on the neck. This is where the thuja will get warts. So I studied his case again, and you can see the rubrics. Anger, contradiction form. Anger, if things don't go his way. Anticipation, exam before. Benevolence, censorious. Cautious. Contradiction, intolerant of. Body, delicate. He is a criminal. So this is Thuja. And I gave him Thuja 200. Within the first dose, his pain reduced by 50% and his painkillers were totally stopped. And then, slowly, steadily, I built his confidence. I kind of counseled him. And now almost more than a year and a half has passed. All allopathic medicine is stopped. Even the neurologist is not able to believe what a miraculous cure. He has referred many neuralgic patients now, and he has accepted himself a little bit more. He is able to express his innermost guilt. This is homeopathy. It acts at the root. And I want to tell you, anyone there with neuralgia, homeopathy is the solution for you. You go to any very good homeopath who goes and takes your case in detail, and he will help you. But go to a homeopath who goes into the depth of your case. I remember another very interesting case. This was an acute neuralgic case where the patient was asked to do an operation within 7 days because he was in so terrible pain and he was having it for 10 years. His only symptom was it was such electric shock like pain and slightest motion and there will be pain, and he had to press it hard. When I analyzed this acute case, I did it on a Skype just by using Bonninghausen and Repertory. I got the remedy Bryonia. And with Bryonia, within 7 days that pain went away. He avoided surgery. Now almost 2 years have passed. This is homeopathy, ladies and gentlemen. I want you to write to me about today's talk, and you can write to me about your difficult cases, your questions, your thoughts. And if you have a neuralgia patient, go to the depth, and homeopathy is the solution.